Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're talking about polycystic ovarian syndrome, better known as PCOS, one of the most common hormonal conditions in women of reproductive age. It can cause irregular periods, infertility, weight gain, and even long-term risks like diabetes and heart disease. But with proper care and lifestyle changes, women with PCOS can manage symptoms and lead healthy lives. To help us talk about it, I'm joined by my colleague, Dr. Bryn Henderson, a board-certified physician and leader in regenerative medicine. Dr. Henderson, thank you for being here with us.
Well, thank you for having me. My privilege.
To start, what exactly is PCOS, polycystic ovarian syndrome?
Well, PCOS is a hormonal imbalance where the ovaries produce higher than normal amounts of the male hormones, which are called androgens. This disrupts the ovulation and can cause small, fluid-filled sacs, what we call cysts in the ovaries. Women may notice irregular cycles, have acne, excessive hair growth, or difficulty conceiving.
Well, I'd like to also add weight gain. A lot of my patients are very, very heavy and they can't seem to shake it. So let's talk about the different types of PCOS.
Yes, the doctors usually describe four. The insulin-resistant PCOS is the most common form, and it's tied to the very weight gain that Dr. PENSANTI just suggested, and also a risk of diabetes. There's a post-pill PCOS that occurs after stopping the birth control. Usually that's temporary. And an inflammatory type that's linked to high inflammation, fatigue, and skin problems. And last or not least, the fourth one is adrenal. Adrenal PCOS is related to stress hormones, more common in younger women.
Let's talk about genetics. Are you doomed to get it because your mother had it?
Well, I don't know if you're doomed, but it's highly more likely. PCOS tends to run in families. If your mother or sister has it, your risk is definitely higher. And certain genes affecting hormones and insulin are involved.
Well, what does traditional Chinese medicine have to say about PCOS?
That's a good question because, of course, TCM addresses PCOS as a problem of balance, though the key stagnation and the phlegm dampness disrupts the balance in the reproductive system. Treatments like acupuncture and herbal remedies aim to restore this balance, regulate cycles, and support fertility.
So, doctor, how would you diagnose PCOS in your clinic?
Well, the diagnosis usually follows the Rotterdam criteria, at least two of the following. First is irregular or absent menstrual periods. Second is high androgens seen on labs or physical signs like acne or hair growth. And next is polycystic ovaries that are seen on an ultrasound. Other causes like thyroid or high prolactin, another hormone, must be ruled out.
What does it look like on an ultrasound when you look at it?
On an ultrasound, it looks like is that there's little blebs on the ovaries. And so what happens is it's easy to see there's some irregularity on the ovaries.
So, what's the standard of treatment in the United States?
Birth control pills are where we usually begin, and because the progesterone helps make the cycles regular. Fertility, if that's necessary, can be assisted with medications like letrozole and can induce ovulation.
Let's talk about this letrozole. This is a new medicine.
Well, okay. The way in which letrozole works is that it has an influence on the fertility. It's a medication that's used to block the production of the estrogen that encourages the body to produce more follicular stimulating hormone, leading to egg development and ovulation. While not specifically approved for PCOS, It is very successful and it's commonly used off-label, they call it.
So let's talk about metformin, which has been kind of standard of care for a while. Women hate it. They don't like it. Let's talk about it.
Metformin improves insulin resistance. However, it does have its share of side effects, upset tummies and some diarrheals, but it's still been sort of the gold standard for the insulin resistance. Lifestyle is another one. That weight management becomes a big deal here. But Helen started with that many of her patients were heavy. There is no question that when that imbalance occurs, it's hard for those ladies to lose. So diet and exercise remain first line for most women.
All right. You are a regenerative expert. So, of course, I'm going to pick your brain and say, what can we do with regenerative medicine?
Well, regenerative medicine has very good results with this because it works to replace cells and make new ones. So early research suggested that it can restore ovarian function. We've seen it in our office. And not only can you do that with regenerative cells, but exosomes also play a role. Now, these aren't cells, these are vesicles, but they reduce the inflammation and improve ovarian health. Also, there are two more, peptides. Those are proteins. And then the last is the PRP, which is platelet-rich plasma being tested for ovarian rejuvenation and fertility. And it's successful quite often.
So beyond medical treatment, let's talk about these lifestyle changes that you had talked about earlier. Let's dive deeper into lifestyle.
Well, they're central to PCOS. Lifestyle is a big deal. And you start with nutrition. That diet is low in processed carbs. It's rich in lean protein and vegetables because that would help insulin sensitivity. Exercise is key to both cardio and strength training. Is improving the balance in our bodies for weight control. Sleep and stress are true of all of us. We usually need more sleep and less stress. Poor sleep definitely compounds our stress and worsens our hormonal imbalance. So I think mind-body practices like yoga help a great deal. Support like counseling is also important. If you have access to that, please take advantage of it. It affects your mood and self-esteem. It's very good.
I'd like to throw in that some of my patients that are able to give up sugar altogether, and I mean seriously, religiously looking at packages, looking at things, and they do not take any sugar into their body. They seem to lose weight better and control their PCOS. And not everybody, so I'm not saying, but if someone's listening and they can do it, it's worth a try. So
that's done as well as if you're getting into peptides. There's a weight loss peptide, AOD, which just targets the fat accumulation.
Oh.
So if your problem is fat, then you can take a peptide and it focuses on decreasing or eliminating the fat.
What's it called again?
It's called AOD.
Oral or injectable?
It's injectable most of the time.
Okay. All right. So I'm sure that those who are listening who have PCOS or a loved one that has PCOS, which is a chronic condition, what's the long-term outlook for these people?
Oh, it's very good. It's a chronic condition, of course, but it's very manageable. With treatment and healthy lifestyle, women can improve fertility, prevent diabetes, and protect heart health. Early diagnosis and ongoing follow-up key.
Well, let's hear your mnemonic for PCOS care.
That one's easy because it's ovary. So
what does the O stand for?
Ovulation, support with fertility medications.
V.
Vital lifestyle, diet, exercise, sleep, and stress management.
A.
A is for androgen control with birth control pills and medications or natural remedies.
R.
R is regenerative options like the PRP we mentioned and the peptides.
Y.
Yearly follow-up to monitor metabolic and reproductive health is essential.
Well, thank you, Dr. Henderson, for guiding us through polycystic ovarian syndrome, a condition that affects millions of women, but one where knowledge and proactive care can make a real difference. And I do want to throw this in. This has increased in numbers for the last 20 or 30 years because of something that's happening in the United States of America called xenoestrogens. We have something going on in the United States where xenoestrogens and how we ended up with estrogen dominance in our food, in our water supply, that is causing all these estrogen-driven diseases. And one of them is PCOS. And so thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.